My name is Chris Baum. I'm a consultant in the Department of Dermatology at the Mayo Clinic in Rochester, Minnesota, here today to talk about Hidradenitis Suppurativa, which is a chronic inflammatory skin condition that affects approximately 1% of the population. It tends to occur in relatively young adulthood, and the typical areas where it involves the skin include the armpits, the groin, and commonly the buttocks as well. Unfortunately, we don't have all of the answers regarding why this condition develops, but we do know that it tends to be quite long-standing. It tends to be quite difficult to treat in many instances. Many people first develop what seems like either ingrown hairs, pimples, or boils in the typical areas, as I've mentioned. Over time, if left untreated, these can progress and develop into draining sinus tracts and very painful large affected areas of skin. It tends to start out symmetrically, so if it's in one armpit, it tends to be in both. If it's in one side of the groin, it tends to be in the other. Most people start out with just a few what we call lesions, boils, pimples, or draining areas like that. Some people are fortunate, and that extent of disease can remain relatively stable over the course of time without much medical intervention. Unfortunately, a lot of people tend to progress to much larger extent of involvement in those particular areas that can include larger draining areas and larger areas of scarring and sinus tract formation. Two of the more common things that probably bring people in are the discomfort, which can be incredibly excruciating depending on how involved the area is and how broad of an area is involved. And the second thing that can bring people in is the combination of drainage and odor, which they may find incredibly difficult either to treat or to mask, particularly in social situations. It's generally a clinical diagnosis. It's not necessary for a skin biopsy to be performed. There are certain other conditions that may warrant additional workup and testing in order to make sure that some internal or more systemic disease is not involved with the process, but most cases can be diagnosed on clinical grounds. The complications are quite wide-ranging. It's possible to get a soft tissue infection in the areas that are involved. If the disease is left unchecked or untreated for extended periods of time, patients can have extensive areas of scarring. And as I mentioned earlier with these particular locations in the groin and the armpits, it's possible to have impact on particular either bodily functions or everyday functions as a result of the associated scarring. So at the Mayo Clinic, we have a specialty clinic dedicated to Hidradenitis Suppurativa, and within that, we address a multitude of things related to this particular disease. We acknowledge for all of these patients that it's a chronic inflammatory disease that can be challenging to treat. We're keenly aware that there are several variables that can make the disease worse related to lifestyle, including smoking and weight loss issues. We also recognize the fact that since it can be socially problematic for the patients and thereby cause great deals of anxiety and even depression, that we address all of those issues. So we begin with a very thorough examination, history, and that is done by a combination of our medical dermatologists with an interest in Hidradenitis Suppurativa, as well as our surgical dermatologists with an interest in these diseases. If either anxiety, depression, smoking, or weight loss are an issue, we make sure that we facilitate appropriate referrals to help address those important variables. There are several treatment options that we talk about, including medical options, surgical options. It's important to remember that there are several variables that we know make hidradenitis worse for many people, and two of those things include weight gain and smoking. So two areas that we really try to address for our patients is to make sure that their lifestyle and their weight is under optimum control. If they smoke, we offer them smoking cessation services as well to try to take that variable out of the equation. In addition to those things, there are a multitude of different medications that can be tried both topically and systemically, either by mouth or by shots. Depending on the extent and the location of the disease, there are laser options that may be implemented. And then finally, surgery is a very good option for treating hidradenitis suppurativa and can be very, very small local excisions that can be performed in a relatively short period of time with local anesthetic. If patients have more extensive disease that is beyond what can be reasonably managed with patients with local anesthesia, we can collaborate with our plastic surgery colleagues and arrange for much larger surgery as needed. Yeah. Interestingly, surgery seems to be a very robust type of treatment. So for people who have large areas of involvement, if you literally just remove the tissue, that tissue tends to heal in with scar tissue, and the recurrence of hidradenitis in those areas tends to be relatively low. Now that's not to say that they can't develop similar types of disease around the previously treated areas of surgery, and because it seems that some of these people are perhaps genetically prone to this type of condition, that it would make sense that they would develop similar disease in the same location. However, for individuals who have relatively extensive surgery, perhaps removing most of the skin in an armpit or in the groin, many of them, after going through this extensive surgery, have a very, very nice outcome. And if they're able to maintain their lifestyle, as we've talked about before, with good control of their weight, staying away from smoking, and they seem to do quite well. If necessary, we can always implement appropriate medical interventions afterwards.